Is your child on medication and you find yourself asking this question? My child is on medication, but it doesn't seem to be enough. When the medication wears off, my child is back to where they were. My child still has behaviors that are concerning to me. So, well, it's good to know you're not alone, parents, and you've come to the right place, because today we're diving into this tough but important truth, right? That for many children with ADHD and autism, medications are simply not enough. So today we're going to talk about why families are stuck, while children are stuck, what might be missing, and how we approach healing from the inside out. So welcome to Glow with ADHD and Autism. I'm Dr. Hokehe Eko. I'm your Happy Brain Pediatrician. Thank you for being here. What are the limits of medications? And that's a good question, but let's be honest. Yes, medications do help decrease symptoms, right? Stimulants for ADHD can help improve focus, can help minimize hyperactivity, but there's a time limit on it, right? Most medications last 6 hours to 12 hours, but often wear off, and sometimes the child needs a second dose of the medication just to get through schoolwork and homework. SSRIs might decrease anxiety for our children. These medications are not addressing why our children are having difficulty with focusing. It doesn't necessarily address why our children are having anxiety, right? And in other videos that are linked in here, we talked about how anxiety, the very common comorbid, and depression is a very common comorbid disorder that we see in our children with autism. So it's always important to address that for sure. But let me tell you a few things I hear from families, right? I hear my child is on meds, but they're still not sleeping. They're awake all night, or they only sleep for a few hours at a time, in spite of the sleep medication. I hear that the meltdowns haven't stopped. I hear she can focus now, but she's anxious. So what happened? And what do we need to change? They're on the medications and now afraid of the dark or hallucinating. Medication has side effects. Yes, they help, but I want to address this question. How can we go beyond the medication? How can we address root causes of what we see in our children? Because let's face it, medication doesn't address root causes. It's more like a band-aid. It helps the child get through the day, but it wears off. And then we're back to where we started at night. So what can we do? It's important for us as parents to look at what's really going on underneath. Inside of your child's body, what is going on? The thing to note is that both ADHD and autism, there isn't one cause, right? There's multiple factors that come together that create this set of symptoms that we have decided to call autism and to call ADHD, right? But so much research, NIS has found that our children with ADHD and autism have major nutritional deficiencies in important elements like magnesium, iron, zinc, omega-3s. All of these things are such important building blocks to the function of your child's brain, and gut are directly connected. The gut is often referred to as the second brain. So for example, when you talk about sleep, a lot of us parents know that melatonin is produced in brain, and that's what controls the sleep cycle. Did you know melatonin is also produced in the gut? So think about this. Instead of us looking at how can we help the gut and the brain be healthier, we're giving melatonin. And I'm not saying that's a bad thing. It's good. But also, what's even better is addressing why the production of melatonin has decreased. And what can we do about that? Yes. And that's where you address inflammation, because so much research has shown that inflammation is a driving cause or factor of the major symptoms we see in our children with both ADHD and autism. So things like not sleeping well, waking up at night, picky eaters, constipation, or loose stools when they shouldn't be having loose stools. If your child is not an infant and they are having loose stools frequently, that needs to be addressed. That isn't normal. Your child shouldn't be having loose stools still, or baby-like stools. That's a sign of a gut dysbiosis, or that there's imbalance going on in your child's gut, and that needs to be addressed. Environmental triggers or sensors. Your child having lots of eczema or just rashes that you can't control, no matter how much eczema cream you put on it. All of that indicates there's an issue in your child's gut. If you don't address it, the symptoms just get worse. I've seen children who are extremely constipated be really aggressive. And I'm not saying constipation always causes aggression, but I have seen it, that when you address constipation by addressing the gut itself, right? Not just cleaning out the gut, but healing the gut, healing the leaky gut that has occurred as a result of the constipation, then you see that the children are less aggressive. My very first patient had autism and ADHD, and she was very aggressive, not sleeping at all, constipated, was going to the bathroom once a week, picky eater. She never let me touch her. So guess what? I found out about how I found out about the inflammatory effects of gluten and dairy, and told the parents, this is all I know right now. This is what helps my child. Try it and see if it helps. They tried it. Guess what? In 4 months, she was sleeping better, eating better, less constipated, aggression was decreasing. By month 6, oh, I forgot to mention, she was also nonverbal. By month 6, she said her first word, which was "Ma." She also let me examine her for the first time ever. She did not like anyone she didn't know coming close to her. She let me examine her, and she was no longer on the verge of being kicked out of school just because we made nutritional changes. That's the power of decreasing inflammation in your child's brain. Note, I didn't talk about curing. It takes time, it takes consistency, but it can be done and you can see results. Definitely, you can see improvement in your children. And now that family can go out. They couldn't go out before because of the behavior. And now they can go out with their child. The child is happy going back to school, sleeps well at night, and is no longer in pain for backed up constipation. So that's what's possible when you look underneath and look at the root causes of the behaviors. That's what we do differently at Glow Pediatrics. I got retrained as an integrative pediatrician and started Glow Pediatrics. We address imbalances, take a thorough history of your child. We look at specific testing to see what food sensitivities your child has, and we make a tailored, personalized plan, even down to the grocery list with links to buy the items. We encourage parents to do the plans for the whole family because it does work. We have seen it over and over and over again. It does work. We prioritize addressing sleep, nutrition, addressing picky eating, addressing aggressive behavior, because all of these things can be addressed by addressing the nutrition, what your child is eating, what's in your child's physical environment. And we teach parents. That's the biggest part of what we do. We teach parents. We empower you, the parents, because you are the biggest part of your child's care team. An empowered parent, a knowledgeable parent, your child's healing, your child's growth is unlimitless, right? Because you know how to help your child thrive. And it's not just your child, it's your entire family, and you yourself, parent, will see a difference in your health as well. Makes me so happy to share this with you. Ongoing care looks like coaching for our parents where they can ask questions, find community. Parenting is a journey you want with community, a safe place where you can ask questions, be yourself, share your frustrations, disappointments, joys, and happiness. We're here to treat the whole child and family. If you're thinking something is missing, reach out to us. We offer telemedicine in several states, personalized nutrition, and that we can see anyone in any state for that because that's coaching. And so reach out to us and let us know. We are here to help. Sign up for a consult on glowpediatrics.com. Follow us on, subscribe to this channel. Please share it with the family that needs to hear this. Maybe a friend, a family member who's struggling and feels like something else is going on. Please share this episode with them. And we look forward to being of service to you. If you like real practical strategies, we have lots of content on our IG page, Glow Pediatrics, share with other parents. Remember, you are the best parent for your child. Your child is valuable, more than a diagnosis. And our task is to determine their strengths and boost those. There is hope. Reach out to us. Have a wonderful day.